Hi, this is Dr. Art Bartolozzi, and I'd like to talk to you about a torn meniscus. A meniscus is a very important structure in the knee, and what it does is it dampens the load between the two bones, the femur and the tibia. It's very common to have a torn meniscus. Both young athletes can get a torn meniscus from playing football or cutting and pivoting sports, and older people can get a torn meniscus as their meniscus deteriorates, wears out, dries out, and becomes more brittle. These are two of the same diagnoses with two very different presentations. The most common presentation in an athletic torn meniscus is catching, locking, and sharp pain. Sometimes achy pain can be a component, but usually catching, locking, and sharp pain are the symptoms that would alert you to a torn meniscus, especially if you're playing high-level activities. If you're a weekend tennis player and every time you play your knee clicks and is painful, that could be a torn meniscus. Clicking is not always associated with damage. Normal knees can click, but clicking in pain is a concern. And the meniscus itself is a washer so that it dampens the load between the two bones. As the meniscus or washer tears, it can get stuck between the two bones and cause pain and swelling. If ignored, these symptoms can lead to damage to another type of cartilage in the knee called articular cartilage. And this is a coating like paint on the wall. If the meniscus tears the articular cartilage, then that's a serious problem. In the older patient with a torn meniscus, the pain usually is achy in nature, but can also be occasionally sharp. And in those patients, we don't normally treat achy pain with surgery. We treat achy pain with anti-inflammatory medication. Meniscus, as a mobile bearing, can move in and about the knee as the knee performs activities such as walking, climbing, or running. If you squat down very deeply, the meniscus can get caught between the femur and tibia and actually get stuck, resulting in a locked knee. And that is a surgical urgent problem. More commonly, however, as the meniscus fragments, a piece can get stuck and get caught, causing sharp pain intermittently and irregularly. And that pain can be quite severe, because as the piece gets stuck, you're unable to walk. As the piece dislodges and gets into a place not between the bones, you're able to walk. And those symptoms often require surgery. That's different from a meniscus, which has a gradual deterioration and becomes sore and painful and achy without mechanical pain. If the meniscus doesn't break up inside the knee, as it wears, it can become achy. The results of surgery for achy knee pain are not quite as good, certainly, as surgery when there's a torn fragment that we simply remove. The overall results from surgery really depend not only on the condition of the meniscus, but the condition of the hard cartilage called articular cartilage. And once this is damaged, serious and persistent problems can result. As a hinge joint, it's important to have all structures normal inside the knee, so that the surfaces need to be smooth, the meniscus needs to be intact and in the right position, and then the knee would function normally. And when these surfaces are damaged, the kneecap surface, the femoral condyle surface, or the surfaces adjacent to the meniscus are damaged, the knee can have pain even after the torn fragments are removed. Basically, the rule of thumb is, for achy pain, we try conservative measures, and for mechanical pain, we would prefer to pursue surgical measures. So the initial treatment for an achy knee pain would be, there are 5 choices for treatment of the knee: anti-inflammatory medication, injections, bracing, therapy, and finally surgery. So that in the case where the knee has mechanical pain and catching and locking, surgery is preferred. In the case where a knee might have achy pain, surgery may be postponed until conservative measures are tried.